They called my patient the girl who cried wolf. No doctor could explain her intractable nightmares or PTSD symptoms. She had the most intense startle response that I'd ever seen. She literally jumped through the roof when someone knocked on the door to our office. You see, she acted like she had been traumatized and had PTSD. The only problem was that she couldn't remember a trauma, because it turned out she was unconscious when it happened. No other doctor or therapist had been able to figure it out because she didn't know what had happened to her, even though she knew deep down something was very wrong. It turns out that her brain was under anesthesia, but part of her body was still remembering. She had transformed from a high-functioning woman, a medical student, into a scared and withdrawn person. Every time she had a particularly scary nightmare, she'd reach out to a doctor, but nothing ever came of it. Why would such a smart and talented woman change out of nowhere? What happened to her is more common than you might think, and you're going to learn what happened to her and how you can help minimize the chances of it happening to you. Several years earlier, my patient had gone under general anesthesia for a C-section. Fortunately, the delivery was smooth and the baby came out healthy, but Mom was using some cannabis for chronic pain she was suffering from at the end of pregnancy. In the weeks after her C-section, she became very sensitive to touches, especially light touches, and to certain sounds, especially the sound of crying babies. Her doctor told her that she had the baby blues, or what we call postpartum depression. But it didn't go away, and her hypervigilance and hyperarousal symptoms actually got much worse in the coming months. When she came to me years after her symptoms had started, that C-section jumped out to me immediately, as did the cannabis use, and the sensitivity to light touches and to the sounds of crying babies. And within 5 minutes of me asking her these questions, you could see in her eyes the dots connecting of what had happened to her body, and how she was only now finally understanding what had happened. She had been partially aware under anesthesia, but not enough to fully remember the trauma at the time. When I walked her through the anesthesia process, bits and pieces began to come back to her. Subconsciously, her body had been holding onto this for years. Anesthesia awareness, or being awake under anesthesia, comes in many different flavors, like remembering sounds, sensations, or even pain. Fortunately, it's very rare, with estimates ranging from 1 in 1,000 general anesthetics to 1 in tens of thousands of general anesthetics. But many factors influence that risk, including the type of surgery, like obstetric surgery, where that risk can be as high as 1 in 600. This is for many reasons, one of which is because we try to minimize extra or unnecessary anesthesia medications that might put the baby to sleep and cause complications in the newborn. Because whatever anesthesia or chemicals are reaching mom's brain are also reaching baby's brain. On top of that, patients that use pain medications like opioids or cannabis also increase their tolerance to anesthesia, meaning they need more medication to stay asleep. And this is especially true of cannabis because many patients still don't tell their doctors about how much they use. Cannabis, anxiety medications, and opioids can all increase the needed anesthesia doses and may increase the risk of awareness if those higher doses aren't given for safety reasons during surgery. Even though anesthesia awareness is so rare, you can see that this woman had a perfect storm of risk factors that led to her anesthesia awareness. For example, she told me that a breathing tube was placed, and that means that she was given paralyzing medications to allow the breathing tube to go in. Those breathing tubes look like this, and they go behind your tongue into your trachea to give oxygen to your lungs. We need to give paralyzing medications, also called neuromuscular blockers, to place these breathing tubes. Otherwise, the patient will gag or buck and prevent us from safely placing the breathing tube in the hole that it needs to go into, behind your tongue. The problem is that when patients are paralyzed, they can't twitch or move to indicate that they might have a little bit of consciousness. And that can increase the risk of anesthesia awareness if the doctor can't tell the patient might be waking up a little bit. Placing the breathing tube is very stimulating, so if a patient's going to remember something, this is sometimes one of the events that they might remember or their body might remember somewhere deep inside. And it's not by accident that some patients may have high sensitivity in their neck and throat area if their body registered some of that pain during the intubation. The other painful part of a C-section is the actual incision on the belly. And that's the other time that the brain might come online if it's supposed to be asleep under general anesthesia. I didn't think it was a coincidence that this woman had such exquisite sensitivity to light touches if she had any bit of awareness during the initial C-section incision when she was supposed to be asleep. Once the baby is removed, then we deepen the level of anesthesia because now the newborn is no longer at risk of being anesthetized themselves. But one thing happens before the umbilical cord is cut. The baby begins to cry. While C-section babies might not be as likely to cry as vaginally born babies, patients under anesthesia are more likely to remember hearing things than any other sense in the body. This is because our sense of hearing is most resistant to anesthesia, and therefore it's the most likely to stay online if everything else is turned off. Since the last thing to happen to patients before they get really deep under anesthesia and C-sections is cutting the umbilical cord, I suspect that maybe the patient's brain had encoded some of the crying baby sounds before she fell into that really deep sleep. This likely explained her triggers, like the sensitivity to touch around her neck and throat area, and the sounds of babies crying. Her cannabis use likely led to a relative underdosing of anesthesia for a surgery that's already at higher risk of experiencing anesthesia awareness in. Because most doctors and other mental health professionals aren't aware of these nuances of what happens to your brain and body in surgery, she was diagnosed with postpartum depression instead of PTSD from anesthesia awareness. She was trying to get help for her central nervous system dysfunction, but instead was being called the girl who cried wolf. This is actually similar to a phenomena called state-dependent memory, where recreating the situation neurochemically allows for unlocking the buried memories. I suspect I was able to recreate the situation for her psychologically, allowing her to connect the dots to understand what happened to her so that she could process the event, even though it was such a long time ago. If you learned something new from this story so far, please share with your loved ones. Also, let me know in the comments below if any of this resonates with you. The better that you understand your body, the better you can advocate for yourself to get the care that you deserve. And please hit that like button to keep up with all of my educational content. Next, you'll learn what you can do for your safety around surgery and anesthesia to protect your mental health. Fortunately, my patient's case was very rare, and many patients with anesthesia awareness do not develop PTSD afterwards. But there are many things that you can take away from her experience to minimize the risk of this happening to you, because about 50% of patients still will experience some type of complication from anesthesia awareness. First, you want to tell your doctor about all of your medications, including recreational drugs, especially anti-anxiety medications, alcohol, opioids, and any cannabis use. Next, ask your doctor specifically what type of anesthesia you'll be receiving. For example, some patients are expecting to be fully unconscious during their surgery, even if that's not the plan. And that mismatch in expectations in surgery can be traumatizing. Third, if you or a loved one is experiencing any psychological distress after surgery, speak with your surgery team right away. The most concerning symptoms are nightmares, sleep disturbances, intrusive thoughts, flashbacks, startle responses, and hypervigilance. Next, be sure to tell your doctor about any lung or heart problems that might prevent you from getting the right dose of anesthesia you need and thereby increase your risk of anesthesia awareness. And finally, be sure to tell your therapist or mental health providers about any recent surgery when you're sharing your story with them. Most mental health providers may not think to ask about surgery or anesthesia as being a potential trigger for psychological distress. What happened to my patient in the end? Once she understood what had happened to her body, she was able to work with her therapist to consolidate the memory and start the next chapter in her life. While this experience did set her back a few years, once she was armed with the right knowledge, she was resilient and bounced right back. I did do some specific work with IV ketamine and the stellate ganglion block with her, which helped augment her inner healing capacity to overcome this struggle. She ended up finishing medical school, and her baby is as healthy as ever. I share her story with you so that you can appreciate that the body keeps score and just how tightly connected the mind and body are. And most importantly, you need to speak up for yourself. Please share what you've learned with loved ones so they can also advocate for their health. Let me know in the comments what else you want to hear about, and hit that like button and subscribe to keep up with all of my content, including these patient stories. Remember, you have more power over your health than you've probably ever been told.